Everest. Why does breathing become so difficult at high altitude? Have you ever wondered why perfectly healthy people can suddenly struggle to breathe while climbing Mount Everest? Imagine taking a deep breath, but your body still feels like it's suffocating. Your heart starts racing. Your head begins pounding. You feel dizzy, weak, and exhausted after just a few steps. And in severe cases, your lungs or brain can actually start filling with fluid. The scary part? It's not because oxygen disappears. It's because your body can no longer get enough oxygen from the thin air around you. Today, we're going to explore the science behind why breathing becomes so difficult on Everest, what happens inside your body at extreme altitudes, the deadly risks of altitude sickness, and the simple survival strategies climbers use to stay alive. Let's begin. Part 1. Why Everest is so dangerous. Mount Everest stands at approximately 8,849 meters, or 29,032 feet above sea level. At sea level, every breath contains plenty of oxygen molecules that easily move from your lungs into your bloodstream. Your body is designed to work perfectly under these conditions. But as you climb higher and higher, something changes. The air becomes thinner. Many people think oxygen percentage decreases. Technically, the atmosphere still contains around 21% oxygen. The real problem is air pressure. At extreme altitude, atmospheric pressure drops dramatically. This means every breath contains far fewer oxygen molecules. Your lungs simply cannot collect enough oxygen. It's like trying to drink through a straw that's almost completely blocked. No matter how hard you inhale, you're getting less than your body needs. By the time climbers reach Everest's summit, the amount of usable oxygen is roughly 1/3 of what is available at sea level. That's why every step feels incredibly difficult. Part 2. What happens inside your body? Let's imagine you're climbing from sea level toward Everest. Initially, your body notices the oxygen shortage. Your brain immediately responds. It tells you to breathe faster. This is why climbers start panting heavily, even while resting. Your heart also speeds up. It tries to pump oxygen-rich blood faster throughout the body. For a short time, these adjustments help. But if you continue ascending too quickly, problems begin. Your muscles receive less oxygen. Energy production drops. Simple tasks become exhausting. You may notice fatigue, shortness of breath, weakness, dizziness, rapid heartbeat. This is your body struggling to adapt. And the higher you climb, the harder it gets. Part 3. Altitude sickness explained. One of the biggest dangers on Everest is altitude sickness. Doctors call it acute mountain sickness, or AMS. This condition occurs when your body doesn't have enough time to adjust to lower oxygen levels. Symptoms often include headache, nausea, vomiting, loss of appetite, poor sleep, fatigue, dizziness. Many climbers ignore these warning signs. That can be a deadly mistake. Altitude sickness isn't just discomfort. It can rapidly progress into life-threatening emergencies. And that's where things become extremely dangerous. Part 4. High Altitude Pulmonary Edema, HAPE. One of the most feared complications is called High Altitude Pulmonary Edema. In simple words, fluid starts leaking into the lungs. Think about that. Your lungs are supposed to fill with air. Instead, they begin filling with fluid. This makes oxygen transfer even more difficult. Symptoms include severe breathlessness, persistent cough, chest tightness, blue lips, extreme weakness. A climber may struggle to walk even a few steps. Without immediate treatment, HAPE can become fatal. The only effective solution is descending to a lower altitude and receiving oxygen support. Part 5. High Altitude Cerebral Edema, HACE. Even more dangerous is High Altitude Cerebral Edema. This occurs when fluid begins building up in the brain. The symptoms can be terrifying. A climber may experience confusion, poor coordination, slurred speech, hallucinations, strange behavior, loss of consciousness. Many victims appear drunk or disoriented. Friends may not realize how serious the situation is until it's too late. Without emergency descent and medical treatment, HACE can be fatal within hours. Part 6. How climbers survive. So how do experienced mountaineers survive in such extreme conditions? The answer is acclimatization. Acclimatization means allowing your body time to adapt gradually. When climbers gain altitude slowly, the body starts making important adjustments. The kidneys help regulate blood chemistry. The body produces more red blood cells. These extra red blood cells carry more oxygen. Over time, oxygen delivery improves. This adaptation dramatically increases survival chances. That's why professional climbers follow a strict rule. Climb high, sleep low. Move slowly, never rush. Patience saves lives on Everest. Part 7. The importance of rest days. Many climbers schedule rest days after gaining altitude. For example, after every major elevation gain, they may spend 1 or more days resting. Why? Because the body needs time. You cannot force adaptation. You cannot train yourself to ignore oxygen deprivation. Your body must physically adjust. Skipping rest days is one of the biggest mistakes inexperienced climbers make. Part 8. Hydration and nutrition. Hydration is another critical factor. High-altitude environments cause faster fluid loss. Dry air increases dehydration. Heavy breathing causes additional water loss. When climbers become dehydrated, symptoms of altitude sickness often worsen. That's why drinking water regularly is essential. Nutrition matters too. The body burns enormous amounts of energy in cold, low-oxygen environments. Climbers need sufficient calories to maintain performance and recovery. Part 9. Why alcohol and excess caffeine can be a problem. Many experts recommend avoiding alcohol at high altitude. Alcohol can worsen dehydration. It may also interfere with breathing patterns during sleep. Excessive caffeine may contribute to dehydration in some individuals and worsen symptoms like rapid heartbeat or anxiety. When your body is already struggling for oxygen, anything that reduces performance can become a serious problem. Part 10. Oxygen masks on Everest. You may have seen climbers wearing oxygen masks near the summit. That's because the summit lies within what's called the death zone. Above approximately 8,000 meters, oxygen levels become critically low. The human body slowly begins deteriorating. Even resting becomes exhausting. Supplemental oxygen helps climbers maintain safer oxygen levels and improve performance. Without it, the risk of severe complications rises dramatically. Conclusion. So why does breathing become so difficult on Everest? Because the higher you climb, the lower the air pressure becomes. Your lungs receive fewer oxygen molecules with every breath. Your heart works harder. Your brain receives less oxygen. And if you ascend too quickly, altitude sickness can become life-threatening. The key to survival is simple. Climb slowly, take rest days, stay hydrated, avoid alcohol, listen to your body, and never ignore symptoms of altitude sickness. CTA. If you found this explanation helpful, hit the like button, subscribe to the channel, and turn on notifications for more doctor-style health and survival breakdowns. And if you're planning a trek or high-altitude adventure, save this video now. You might remember these tips when they matter most. Stay safe, and I'll see you in the next video. Thanks for watching, and please subscribe my YouTube channel.